Hi, I'm Kathy from Simple Fit Physical Therapy, and today I wanted to talk to you about fall prevention. And as always, we have Jersey coming in to join us. I think she wants to be a YouTuber. The reason fall prevention is so important to me is because every day in the clinic, I see people that are at higher risk of falling. In fact, 1 in 4 adults over the age of 65 will have a fall every year. And of those people who fall, about 10 to 15% will have a fracture or a broken bone. This can lead to serious health consequences and impact your quality of life. It can even prevent you from being able to live independently. So that's what we're going to do today. We're going to talk about how you can prevent falls. Things that can increase your risk of falls include changes in your eyesight, problems with your feet, and medication interactions. In addition, there may be some things around your house that aren't as safe as they could be. And as we age, slower reflexes and weaker muscles can also contribute to imbalance. People over the age of 65 should have their vision checked at least every 1 to 2 years. This will ensure that you're wearing the right eyeglasses because vision plays a big part in your overall balance. Another thing that you can do to reduce your risk of falling is have your healthcare provider check your feet at least every year. During this visit, you can discuss what is the best footwear for you and whether or not you need to see a specialist like a podiatrist. If you take medicine, you should ask your healthcare provider whether or not your medicine could be contributing to your imbalance. Certain medications can have side effects and interactions that can make you feel dizzy and sleepy, and even your over-the-counter supplements can interact with your prescription medications. So be sure to talk to your healthcare provider or your pharmacist to make sure there's not any of that going on. As for your home, there are some things that you can do to make it safer. First of all, let's think about the bathroom. Having grab bars near the bath or the toilet can be helpful. Also, you'd want to have non-skid mats on the floor and in the tub to make sure you don't slip and fall. You might also consider getting a shower bench or a handheld shower just to make bathing a little bit safer and easier. You'll also want to make sure your home in general is well lit and use night lights at night. If you have to get up at night, a night light can help make sure that you can see where you're going. If you have stairs, you want to make sure that there's a handrail available and also make sure that the area is lit, especially at night. People often trip on stairs. You'll want to keep paper, books, clothing, and shoes up off the areas where you walk, especially the stairs, because that can lead to a trip hazard. You'll want to remove any small throw rugs or make sure they're secured using double-sided tape. You'll want to keep items that you use on a regular basis within easy reach so that you don't have to use a stepladder to get to them. And you'll want to wear well-fitting shoes that are supportive inside the home and outside of the home. As people age, they sometimes get weaker. Often this is due to inactivity. As adults, we should be getting at least 150 minutes of physical activity every week. This may seem like a lot, but you can start with just 10 minutes a day and slowly build up as your fitness improves. Even 10 minutes a day can go a long way towards helping you meet your overall fitness goals. If you don't know where to start with exercise, I would recommend starting with short walks and gradually building up as your fitness improves. You could even check out some of my videos. I've got several that go through some simple programs, either standing, holding onto a chair, or sitting down, and even some lying down. And if you've already had a fall, make sure you visit your doctor to make sure that the other things we mentioned earlier are taken care of, and also consider a visit with your local physical therapist. They can formally assess your balance and tailor a home exercise program just for you. They can also make recommendations on whether or not you could use an assistive device, which one to use, and how to use it. I hope you found these tips helpful. If you like this video, you might want to check out these videos over here. Thanks for stopping by, and I hope to see you again soon.